Welcome to today's lecture on the topic of vocal cord paralysis. In this comprehensive script, we will delve into the intricate details of the anatomy, innervation, mechanisms, classification, etiology, evaluation, management, complications, and rehabilitation of vocal cord paralysis. We will also explore the future directions and research pertaining to this condition. So, let's begin our journey by understanding the basics of vocal cord anatomy and function. In simple terms, the vocal cords help us make sounds by opening and closing. They are made up of different tissues and muscles. Understanding how they work is important for understanding vocal cord paralysis. The vagus nerve, particularly the recurrent laryngeal nerves, innervate the vocal cords. These nerves control the intrinsic muscles of the larynx for vocal cord movements, essential for voice production and airway protection. Vocal cord paralysis occurs when this innervation is disrupted. Maintenance of proper vocal cord movements necessitates the balance between abduction and adduction. Vocal cord abduction takes place during normal breathing to ensure an open airway for respiration. In contrast, vocal cord adduction occurs during speech and singing, allowing precise voice production. Various intrinsic and extrinsic muscles of the larynx work in harmony to achieve coordinated and precise vocal cord motion. Any disruption in this delicate balance can lead to vocal cord paralysis and subsequent voice and breathing impairments. Vocal cord paralysis can be classified into two main types, unilateral and bilateral paralysis. Unilateral paralysis involves the loss of motion in only one vocal cord, while bilateral paralysis affects both vocal cords. Each type presents with distinct clinical features and functional implications. Furthermore, vocal cord paralysis can be further classified based on the specific level of nerve involvement, such as superior laryngeal nerve palsy or recurrent laryngeal nerve palsy. Accurate classification is vital for diagnosis, treatment planning, and prognostication. Vocal cord paralysis can occur due to various etiological factors. Nerve damage is a primary cause, with RLN injury being the most common. Nerve injury can result from surgical procedures, particularly those involving the neck or chest. Trauma, including neck trauma, can also lead to vocal cord paralysis. Other causes include viral infections, tumors, thyroid surgery complications, and neurological conditions. Understanding the underlying causes aids in identifying potential risk factors, preventive measures, and tailored management strategies. Unilateral vocal fold immobility is often better tolerated due to the compensatory mechanisms of the intact vocal cord. However, unilateral cases still result in voice changes, breathiness, and sometimes aspiration, especially during physical exertion or significant airway demands. On the other hand, bilateral vocal fold immobility poses more significant challenges, impairing both breathing and phonation. Bilateral cases necessitate prompt intervention to ensure adequate airway management and voice rehabilitation. Accurate evaluation and diagnosis of vocal cord paralysis are crucial for devising appropriate treatment plans. A comprehensive clinical assessment involves obtaining a detailed history, including potential inciting events, symptoms, and previous medical interventions. A thorough physical examination, including indirect laryngoscopy and videostroboscopy, aids in visualizing vocal cord motions, structural abnormalities, and evidence of paralysis. Additional diagnostic tools, such as electromyography and imaging techniques, provide objective data to support the diagnosis and inform treatment decisions. Laryngoscopy, performed either directly or indirectly, allows for visualization of the laryngeal structures and vocal cord motion. Indirect laryngoscopy provides a non-invasive and readily available tool, but direct laryngoscopy provides enhanced visualization during certain procedures. Electromyography, meanwhile, assesses the electrical activity of the vocal cord muscles, aiding in the determination of muscle function and detecting nerve-related abnormalities. Combining these diagnostic modalities facilitates accurate diagnosis, determines the extent of vocal cord injury, and assists in devising management strategies. The management of vocal cord paralysis involves considering the cause, severity, patient preferences, and associated symptoms. Medical interventions like voice therapy and vocal exercises can improve vocal cord function and voice quality. In some cases, surgery may be necessary, such as vocal cord injection, thyroplasty, or reinnervation procedures. This decision is made by a team of healthcare professionals. In vocal cord paralysis, complications impact voice production and breathing. Common voice changes include hoarseness, breathiness, decreased range and volume control. Breathing difficulties, shortness of breath and aspiration, affect quality of life. Prognosis depends on causes, severity, timely intervention and rehabilitation. Early intervention yields better outcomes and minimizes complications. Speech therapy and vocal exercises are crucial for rehabilitating patients with vocal cord paralysis. Therapy aims to improve vocal cord function, voice quality, breathing techniques, and reduce vocal strain. Different approaches, like respiratory training and vocal exercises, help retrain and coordinate vocal cord muscles. Personalized treatment plans are necessary to address individual needs. A team effort involving patients, speech-language pathologists, and other healthcare professionals leads to the best outcomes. The field of vocal cord paralysis research is continuously evolving, seeking new advances and innovations to enhance diagnosis, management, and rehabilitation. Ongoing studies focus on neuroprotection, nerve regeneration, and novel surgical techniques to improve outcomes. Emerging technologies, such as bioengineering approaches, tissue engineering, and regenerative medicine, hold promise in the development of more targeted and effective interventions. Collaborative efforts involving researchers, clinicians, and industry experts aim to optimize quality of life for individuals with vocal cord paralysis. In conclusion, vocal cord paralysis is a condition that affects voice and breathing. Understanding its anatomy, causes, evaluation, management, and rehabilitation is crucial for comprehensive care. Continued research can improve diagnosis and treatment, enhancing patients' quality of life.